Thank you, Mr. Chairman. I appreciate you holding this hearing, and I want to thank all of the panelists for coming and participating. I know I've talked to a number of healthcare professionals as well as many of my constituents and listening to the panel as well. I want to join with Chairman Upton in urging the President to immediately institute a travel ban until such time that they can firmly and scientifically prove that Americans are safe from having more Ebola patients coming into the United States. And I know, Dr. Frieden, you expressed disagreement with that. Have y'all had any conversations within the White House about a travel ban and whether or not the President has the authority? Because many of us have said the President does have the authority to do it today.
From the point of view of CDC, we're willing to consider anything that will reduce risk.
But have you considered that? And have you ruled it out, or have you not considered it at all? Have you had conversations with the White House about a travel ban? That's a yes or no question. Have you had conversations with the White House about a travel ban?
We've discussed many aspects.
How about a travel ban? Have you had that conversation with anyone in the White House?
We've had discussions on the issue of travel to and from West Africa.
And have y'all ruled it out?
I can't speak for the White House. I can tell you that
you can speak for the CDC. If you were in those conversations, maybe they had their own conversations without you, but if you were involved in conversations with the White House about a travel ban, did they rule it out? Are they still considering it?
From the CDC's perspective, we will consider anything that will better protect
So
America.
Are you going to answer the question about your conversations with the White House? Is the White House considering a travel ban?
I can't speak for the White House.
Do you know if they've ruled out a travel ban?
I can't speak for the White House.
Have you had conversations with them about it?
We've discussed the issue of travel.
All right. I would urge you, at a minimum, if you've ruled out a travel ban, if you don't think it's the right way to go, there are a lot of people that would disagree with you. At a minimum, you ought to look at least immediately suspending visas to non-U.S. nationals seeking to travel into the United States from Sierra Leone, Liberia, and Guinea. Have you all considered that or discussed it or ruled it out?
At CDC, our authority is to quarantine individuals or require the isolation of individuals.
But earlier you said you don't think there should be a travel ban. What about at least looking at suspending visas to non-U.S. citizens? Have you looked at that?
CDC doesn't issue visas.
But you can make a recommendation to the White House that it would be in the best interest of the American people to have that kind of suspension issued, can't you? Are you not aware of that?
We would certainly consider anything that will reduce risk to Americans.
Let me ask you this. Do you have a high level of confidence that our U.S. troops that are over there right now, I've got estimates that around 350 U.S. troops are already in those three affected countries. Up to 3,000 troops are going to be sent over by President Obama. Do you have a high level of confidence that those U.S. troops are protected with all the protocols in place so that they will not contract Ebola?
We've worked very closely with DOD on their protocols.
So do you have a high level of confidence that they're protected?
I would not say that there's zero risk. They are in those countries, but they are not participating in high-risk activities that would put them at risk. Are you
consulting with DOD? Who establishes the protocols in that case? Is the CDC involved in that?
They are following the CDC protocols, but they follow their own.
Let me ask you about the protocols, because I've read reports that some people with some of the other organizations that have been over there for a while, you've got the group Samaritan's Purse, a gentleman by the name of Sean Kaufman, who's involved with some of the doctors that have been over there that have gotten infected. They've been working for decades in some cases. He said that he warned your agency that the guidelines that you had on Ebola were lax, and his response was, quote, "They kind of blew me off," meaning your agency blew him off when he was warning you that your protocols were lax. Are you aware of that?
I saw that quotation. We take all suggestions.
Have you identified who blew him off in your agency?
I don't know that that occurred.
Well, I would hope that you'd go and find out, because there's a real concern. You know, one of the biggest concerns I get from the hospitals in my district that I've talked to, and I've talked to a number of hospital officials, medical officials, professionals in my district, they're concerned that they haven't had consistent protocols. There's been at least 4 just in the last few weeks where the protocols keep changing. Now, with the nurse, the first nurse that was infected, I believe you personally said that the protocols were breached originally. Have you backed away from that?
We're looking at what might have
You
resulted.
said the protocols were breached. Were the protocols breached with the first nurse that was infected? Yes or no?
Our review of the records suggests that in the first few days of
If you didn't know
Mr.
for a
Duncan's-
fact, you shouldn't have
Gentleman's
said
time's
it.
expired.
Do you withdraw that statement, or do you still stand by the statement that protocols were breached by the first nurse?
there was a definite exposure that resulted.
Were protocols breached,
Gentleman's
yes or
time's
no?
expired.
Yield back.
Thank you.